All right, well, let's pick up and begin our lecture into the skeletal system. I don't know why the screen is a lot smaller today than it's not showing up big, but it is what it is. I'll just zoom in further. All right, let's talk about bones. Initially, our human skeleton is made mostly up of cartilage. And this is all, more before we're even born, okay? By the time we reach adulthood, most of that cartilage is replaced by our bone tissue, but can be felt in, especially newborn infants. In their skull, they have what are called soft spots, which we'll find out on Monday what the fancy term for those soft spots are. Obviously, it's not recommended to press on these. Remaining cartilage can be found in a person's ears, nose, ribs, and in their long bones. We'll be talking about the growth plate, growth line in our long bones here, actually on the very next slide, which is where you'll find cartilage inside of our bones. Osseous tissue or bone tissue is connective tissue, which is the matrix hardened by the deposition of calcium, phosphate, and other minerals, and is the key tissue found in our organs called bones. Osteology is the study of bone structure and the treatment of bone disorders. Aside from the bone tissue, within our bones or associated with our bones are additional tissues, which include our blood, bone marrow, cartilages we've already mentioned, previously anyway, adipose tissue, nervous tissue, and fibrous connective tissue. That fibrous connective tissue really relates to these two types of structures, ligaments and tendons. Ligaments are described as fibrous bands that help hold various bones together into an organized skeleton. So they're very, very involved with just about any and every bone, not every bone, but in many of them. Here's an easy way to remember what ligaments do. Write out the phrase bone to bone. It's the simplest way to remember what they do. They connect bones to bones. So next to ligaments, easy way to remember it, bone to bone. I'd write that down. So like the ACL in the knee, PCL, MCL, many others in many other places as well. We'll talk about those when we get into our joints lecture toward the end of this year. Actually, that is our last lecture. Tendons are described as fibrous bands that attach, and the key phrase there is the easy way to remember it, muscles to bones. Similar structures, very strong, kind of cord-like, but they hold two different things together. Bones to bones for ligaments, muscles to bones for tendons. Okay. Overall, our bones and the skeletal system provide 7 kind of general functions. The first two probably the most prominent, kind of common sense type, support and protection. Bones serve as the supporting framework of the body by supporting soft tissues and providing attachment points for tendons of skeletal muscles. Most skeletal muscles protects hard bony boxes, protect the delicate structure or organs that they enclose. We've kind of got 2 major boxes, our thoracic cage, which is going to include our sternum, ribs, and vertebrae to protect our lungs and heart, and then our cranium, our skull, in case it encloses in the brain. Movement, third function, interaction of bones, make levers that can move when placed under mechanical force. In other words, muscle contraction. We store minerals and can release them if needed, like calcium, phosphorus, and other minerals, which we don't just store in our bones because in some cases we need to release them into the blood to maintain those critical mineral balances. We produce our blood cells within what we call the red bone marrow of our bones. Now this is all of our types of blood cells, red blood cells, white blood cells, platelets. The process in which we form blood cells is called hemopoiesis or hematopoiesis. These terms are the same meaning. Okay, it's just two different ways to describe the same thing. Okay. Acid-base balance, our bone tissue or osseous tissue buffers the blood against excess pH changes by absorbing and releasing alkaline salts. And then there's another type of bone marrow called yellow bone marrow, where we store fat or adipose tissue, as we know, storing triglycerides. Okay, now on Monday, when we start going through the actual bones of the skeleton, one of the first couple slides in our next lecture is going to talk about the different categories of bones based on their shape. And there are obviously long bones, which is what you guys are writing out information on right now. There's also short bones. And then there's also flat bones, along with some other special shapes. On this page, I wanted to kind of talk about some key features of more so long bones, because they are pretty complicated. And then flat bones as well, which are quite a bit more simplified or simple. All right, so looking at the bottom, I'm going to start with the flat bone, like what's shown here, with a couple of skull bones, the frontal parietals, or aparital, I guess, not both of them at this point in the picture. But a flat bone can be kind of thought of like a sandwich, okay, where you've got like two pieces of bread on the outside, compact bone, okay. The outer compact bone is also what we had up here as the external table, the hard wall on the outer surface of a flat bone, whereas the internal table is what's listed here as the inner compact bone, okay. Look at the thickness of that compact bone compared to the thickness of the spongy bone, which is what's called the diplo, okay, which is the region between the internal and external tables. In our flat bones, especially, there's a really thick amount of and a large amount of spongy bone. Okay, we'll talk more about spongy bone later on in this lecture, but this is where you find the red bone marrow, okay, in those spaces between the actual bone flakes. Okay, the reason that we can get away with having really large amounts of spongy bone in our flat bones, places like our, sternum or shoulder blade, okay, they're not really weight bearing typically like your long bones are, which have to be a lot stronger, like what's shown over here with what's called the humerus, your upper arm, okay? Now, the key with a long bone is it has to be longer in length than it is in width, okay? Obviously, your humerus is a great example of that. So would like your femur, your tibia, your forearm bones, on in radius, but it could be as small as like the tip of your pinky, okay, which is really a short, not very long bone, but it is longer than it is wide. And it's got these same features, just a lot more, shrunk down, okay? There are kind of three distinct parts to a long bone, okay? The shaft, which is known as the diaphysis, and then two bulbousy fat ends, which have a lot of times special features because this is where you're going to form joints. Like up here at the top, the proximal epiphysis would be where the shoulder would be. The distal epiphysis would be down where the elbow is. Okay. The epiphyses are the fancy ways to describe those bulbousy ends. Okay. There's also a kind of region in between the epiphysis and the diaphysis on each side. We call that the metaphysis. Okay. So think of that kind of like your neck. Okay. The point between your head and your torso. Okay. Something special found in the metaphysis is what we call the epiphyseal or growth plate, a layer of hyaline cartilage allowing a diaphysis of the bone to grow in length. Okay. So if I zoom in here, what we've done is we've cut the front of the humerus off up here by the shoulder, and we can show the internal features, which includes this epiphyseal line. Now I just said it's called an epiphyseal plate, okay? But what's pictured down there and it says is the epiphyseal line because this is what is formed when our bones stop growing. That layer of cartilage is replaced by bone, resulting in the structure known as the epiphyseal line. So basically it's kind of like a scar that's left over, forms when we stop growing. Let's see. All right, let's talk about covering the ends of our bones. It's what's called articular cartilage. Anytime you see the word articular, articulate, that's going to tell you right away we're talking about a joint. Okay. Now a joint can be complicated like the shoulder or the elbow that's shown here, but it could be as simple as just the connection between, your pinky bones. Okay, where there's two bones coming into contact with one another. We don't want those bones, grinding on one another. So there's a slippery, thin layer of this articular cartilage, kind of shown here in blue, that allows the bones to glide over one another. Unfortunately, as we get older, a lot of times that wears out, which can lead to painful joint condition. What condition am I talking about? What is it? Arthritis, specifically osteoarthritis. Okay, not to be confused with rheumatoid arthritis, which actually happens a lot more in kids, unfortunately. But osteoarthritis is what grandma and grandpa have after just years of that cartilage just kind of getting worn away. All right, on the outside of our bones is a thin membrane called the periosteum. Okay, we've pulled it away there in the picture to show it off. It is made up of two layers, an outer fibrous layer made up of dense irregular connective tissue, and this is how our tendons and ligaments connect to the bone. They interlace the periosteal fibers, thereby anchoring either the ligament to the bone or the tendon, and therefore the muscle to the bone. The inner layer is composed of cells enabling a bone to grow in thickness, not in length, and is attached to the underlying bone through what we call perforating or Sharpie's fibers, thick bundles of collagen fibers attached to the extracellular matrix of our bones. Okay. Do not confuse the periosteum with what's called the endosteum. The prefix endo, think inside. Okay. The endosteum is a membrane that is found on the inside of our, what we call, medullary cavity. The medullary cavity is a space on the inside of our bones, okay, specifically throughout the diaphysis, okay, also called a marrow cavity, because this is where you find bone marrow, specifically the fatty yellow bone marrow that we have as adults. Okay, as you can see here, that's what it says in parentheses. Okay, I told you guys this back last week when we talked about tissues that bones are not solid all the way through. They have a cavity on the inside. That cavity is the medullary cavity, lined by what's called an endosteum. Okay. Now, remember we talked last week when we discussed tissues that there's two types of bone, compact bone and spongy bone. Okay. Looking throughout the diaphysis, we can't do it down here so much, but in here we can. Okay. We really don't see much of the spongy bone. Predominantly throughout the diaphysis is that compact bone forming the shell of our bones. Okay. We find a lot of our spongy bone out in the metaphysis and the epiphyses. Okay. So spongy bone located in epiphyses of the long bones, adapts to changes in chronic stresses and weight, postural change, and muscle tension. And this is where we find red predominantly, but we also find yellow bone marrow being stored. The spongy bone does help support body weight without adding much, overall physical weight. Okay. Compact bone forms the hard or dense superficial layer, which offers protection, support, and the ability to resist stresses produced by weight and movement. I think I covered everything up here. So at the bottom here, these two pictures, make sure you know them. They are going to be fair game, especially this one, which is a lot more complicated than this easy one. This one, you just need to know the three things on the side over here. Pretty much everything. All right, thinking back to last week when we talked about connective tissues, we learned that connective tissues were unique compared to the other tissues and that the cells were widely separated and they had those big spaces full of extracellular matrix. So bone is no different. It is a connective tissue with an abundant extracellular matrix surrounded by these widely separated cells. Within the bone matrix, you have inorganic salts and an organic matrix. And percentage-wise, it's about 15% water, 30% collagen fibers, and 55% crystallized mineral salts. Those mineral salts provide for the hardness of bone. Okay, and we're talking predominantly calcium and phosphate. Together, they form what's called calcium phosphate, which is the most abundant of those mineral salts. Crystallization of these salts within the framework formed by the collagen fibers of our extracellular matrix is called calcification. And the process is performed by bone building cells called osteoblasts, which we'll talk about at the bottom of the page. A bone mineral density test is a way to measure the density of minerals such as calcium and phosphorus in our osseous tissue. Something that's done a lot of times in elderly populations to see how strong their bones are. It's kind of like a full body x-ray, except instead of looking for fractures, they were looking to see how densely packed in the bone is. Okay? Bone is a use it or lose it type tissue, meaning that if you sit on a couch your entire life, your bones will not be as strong as if you are a very active individual. Physical activity is fantastic for your bones. It makes them strong and protects against brittle bones as we get older. Okay? Especially ladies, it's very important to get physical activity and do weight-bearing type activities. Okay? Doesn't mean you have to be a bodybuilder, no. And the reason why ladies are so susceptible is because once a lady reaches menopause, she stops producing as much estrogen, which promotes strong bones. And so ladies are especially susceptible to, you might know what the name of that disease is? Not arthritis, but osteoporosis. So there's your PSA for the day. As a whole, the organic matrix adds strength and also gives bones some degree of plasticity, which means that they're going to flex a little bit. So when applied stress within limits occurs, does not result in frequent crush or fracture. So our bones have a little bend in them, which is great because we don't want them to be really, really, really brittle. And we don't want them like a dead stick that you find in your yard, or if you just even bend it a little bit, it's just going to snap. We don't want that, obviously, for our bones. The organic matrix is composed of collagen fibers and ground substance. The collagen fibers are what provide for that flexibility. Collagen fibers are also necessary for the process of calcification to occur. So they provide great tensile strength, resistance to being stretched or torn apart. I should say, and resistance to being stretched or torn apart, I guess. Ground substance is a mixture of proteins and polysaccharides. Polysaccharides are carbohydrates, which provide support and adhesion between cellular and fibrous elements. A cool example, or a cool experiment, I should say, in which you can show how bendy bones can actually be, is if you take like an uncooked chicken bone or something like that, and you soak it in vinegar for a couple of days. The vinegar will basically kind of just eat out all the calcium, so take a lot of the hardness out. You can take that bone and you can actually bend it like it's rubbery. It's really cool. I say an uncooked bone because cooking bones, like if you bake chicken or whatever, you actually kind of strip the collagen down, break it down, so it loses that plasticity, so it loses that flexibility, and a cooked bone is really brittle, which is why you're not really supposed to feed like dogs cooked bones. My dog loves to dig in the trash and get the cooked bones. Despite that, the reason is because when they chew them up, they fracture up, they splinter, and then that can cut their digestive tract up. Fortunately for her, nothing's ever happened like that we're aware of. She's kind of like a billy goat. She eats everything. Anyway, all right, let's talk about the cells in our bone tissue, starting with osteogenic stem cells, or as they're listed down here, osteoprogenitor cells, which are described as unspecialized cells found in the endosteum, which we just described as the inner lining of our medullary cavity. And then we'll talk about what central canals are here on the next page. But as you can see here in our picture at the bottom, there's an arrow pointing from them to the next cells, osteoblasts. And that's because these are the ones that undergo cell division and become the osteoblasts. Now, the osteoblasts are described as the bone building cells, and we already mentioned those at the top of the page. Sound and are spelled very similar to osteoclasts. The only difference is one letter, letter C in osteoclasts, letter B in osteoblasts. The great thing about osteoblasts is they build bone. And guess which letter starts the word build? The letter B. So it's easy to remember osteoblasts with a B, build bone. So, keep that in mind to help you remember what osteoblasts do. What they do is they synthesize and secrete collagen fibers and other organic components needed to build the extracellular matrix of bone tissue. A process that's called mineral or bone deposition. Also, you can just call it mineralization. The crystallization process in which calcium phosphate and other ions taken from our blood plasma made into bone tissue. So I kind of like to use an analogy of pouring concrete, okay? So this summer we had to replace our patio. They poured concrete. The guys were in there doing, moving the concrete around, making it flat, okay? When you're pouring concrete, if you've never been around somebody pouring concrete or been involved with it, one thing you want to avoid is just staying in the middle of the concrete as the concrete hardens. Okay? Because over time, what's going to end up happening, you're ankle deep in that concrete, you're going to get stuck. Okay? Well, osteoblasts actually just stay put where they're at. So they synthesize and secrete all that concrete, the actual bone tissue around themselves. And so they get stuck in place. And then they mature. You can see the arrow pointing from them to the next cells, and they become osteocytes. Mature, non-dividing osteoblasts that have become surrounded by the extracellular matrix. These are the main cells in our bone tissue and maintain its daily metabolism. Because bones are living structures, they need nutrients and they produce waste as well. So obtaining nutrients, eliminating waste. As osteoblasts surround themselves with extracellular matrix, they become trapped in their secretions and become osteocytes. Our final cells, you can see there's an arrow, or not an arrow, but a line pointing, or dividing, I should say, these three from this cell, because these three are related to one another. Osteoclasts actually come from bone marrow because they are of white blood cell lineage, as it says there. Okay. Osteoclasts, think of the word carve, which is spelled C-A-R-V-E, which is nice because carve begins with the letter C, which is the discernible difference between osteoblasts and osteoclasts. So if it helps, write out the word carve, which is what they do. They take bone and erode it, meaning they carve out the calcium and minerals and release it into the blood. So they do the exact opposite of our osteoblasts. Okay? These are very big multinucleated cells, okay, which means that they've got a bunch of nuclei, and that's because originally they are individual monocytes, which are white blood cells, many as 50 of them that then fuse together. Each nucleus from those original cells is maintained. Okay, so you've got a big old blobby cell with all those nuclei still present. Okay. The side that faces the endosteum, okay, of our bones has a ruffled border, kind of like microvilli, little finger-like extensions to increase surface area so that they can enhance bone resorption, which is the process in which dissolving bone is released from our bone into the blood, performed thanks to the fact that there are very powerful lysosomal enzymes and acids that can break down the proteins and mineral components of our bone matrix. This is something that we have to do if we don't get enough calcium in our diet. Okay, we sacrifice the strength of our bone by breaking them down because we need calcium for other things besides just keeping our bones strong. Calcium, for example, is especially important for muscle contractions. So we have to maintain calcium levels in our blood. Otherwise, we won't be able to do certain things like contract our muscles. So get your dairy, especially. Okay, pictures at the bottom, not important. All right, let's talk compact bone in greater detail. Once again, this is a harder, dense bone forming the superficial layer of all bones, constitutes about 80% of the total bone mass. And compact bone is described as having very few spaces and is the strongest form of bone tissue. Okay. If you look at it under a microscope, which we all saw a picture of it under a microscope in our tissues lecture, you will find that there are these cylindrical shaped structural units called osteons, and we've kind of pulled one out to show it, but there are many of them. You can kind of see them periodically throughout just a little segment of this bone, whatever this bone is, it doesn't matter. We can see here's a half of one, there's one half of one over there next to it. Okay, these are the functional units of our compact bone. Okay, think of them kind of like tree trunks. Okay, very cylindrical, round in structure. Okay, they have another name, Haversian systems, but you'll never hear me call them that. Osteon is what I will use 100% of the time, but they have special features. Okay, first feature I want to talk about is what we call its central canal. Central canal is a hole that goes all the way through the length of that osteon. Okay, here we can see one is labeled. This is where you find blood vessels, nerves, lymphatic vessels, that nourish and provide innervation and whatnot to our bone cells. Remember, there are living bone cells in our bone. They need nutrients and produce waste, so they need blood flow to go there. Okay? The red vessels here are arteries. The blue are veins, okay, which provide blood to and away from the bones. Okay? These blood vessels can connect with one another thanks to the fact that there are also perforating canals. Perforating canals are also known as Volkmann's canals, connect one central canal to another. Okay? Which you can see here. You can't see any otherwhere else because we can't see the interior of the osteons. Okay, okay, let's talk about the what we call lamellae of a bone. There's three types of lamellae. Okay, they're all the same thing. It's just differences in location. Okay, concentric lamellae is the cylinder-shaped layers of extracellular matrix in the osteon surrounding the central canal. And they are much like rings on a tree trunk. So there's my analogy with the tree trunks again. Okay, if you look at this illustration zoomed in, okay, we can see the cells all over the place. Those are the osteocytes, things that look like little bugs with one eye, okay, the nucleus, which is what it actually is. In between those cells, you can see is the actual bone matrix, okay, the calcium, collagen stuff that we were just talking about on the previous page. If we see that kind of off-white stuff inside of the osteon, we call it concentric lamellae. Okay. If it's located between the osteons, like right here where it's labeled, we call that interstitial. And if it's around the outside of the bone, towards the periosteum, remember the layer of or membrane covering our bones, okay, or if it's close to the endosteum, towards the inside of the bone, we call it circumferential. Okay, it's just the extracellular matrix located in distinct places. Okay, okay, so that's the bone matrix. Okay, let's talk about lacunae, a fun word to say. Okay, we said each one of these little things that kind of looks like a bug is an osteocyte. We're going to zoom in on one right here. You can see there's the osteocyte. Remember, this is like the cell that gets trapped in the concrete that's dried up and become really strong. Okay. Lacuna, which is labeled here, is the space where that osteocyte is located. Okay. Lacuna is singular. If you add an E at the end of it, like what's shown there at the top, lacunae is plural. Okay. So the cell is located in a space called a lacuna. Okay. Now, I always have thought these look like little bugs because they've got these kind of leg-like extensions that radiate out from the kind of central portion of the cell. And those leg-like extensions radiate out in what are called canaliculi. Probably one of my favorite words to say all semester long. These radiating canals you can see all over the place are these like little tiny faint lines, and they provide avenues for nutrients to perforate out from the blood, okay? Because, for example, the cell that's right here, quite a bit of ways from the blood, needs nutrients just as much as the one that's right next to the blood vessel. So this allows for the nutrients and oxygen to reach the osteocytes and carbon dioxide and other waste to go the opposite direction. Okay. Now, in this image, everything that is already capitalized for you will be fair game for the exam. So highlight those now, star them, underline them, whatever you need to do. Don't forget osteon, which I hate that it's labeled in the picture, but whatever. Anything that's not all caps, don't worry about, with the exception, I do want you to know down here where it says periosteum, know that. And then those two layers that we've already talked about, outer fibrous, inner osteogenic. because that picture might show up. And by might, I mean it probably will. Now, in this picture, we also see a box here that says see figure 6.4b. That's what this picture is. Here on this next page where we're talking about spongy bone. All right, spongy bone, remember, also known as cancellous bone, bone that does not contain osteon. So you don't see those cylindrical units like we saw on the previous page. Instead, it's bone composed of a reticular or latticework structure, which is why spongy bone gets its name, not for its texture. It's not spongy like soft. It's really hard, but it's got those big holes in it, kind of like Swiss cheese. Okay, that's because of the bone branches called trabeculae that are not, thick all the way through. There are the gaps in there, which is where you find a lot of bone marrow, specifically red bone marrow. Now, spongy bone is still bone, so it's still got lacuna, lamellae, canaliculi, just like we saw on the previous page. Okay, the lamellae is the bone matrix. The cells, osteocytes, are still found in the spaces called lacunae. You still got the radiating canals called canaliculi, just like we talked about on the previous page. Okay. The big spaces between the trabeculae act to make bones lighter and maybe fill with red bone marrow for blood cell production, or yellow bone marrow that we'll talk about as well. I've already talked about the next bullet. Nutrients, talked about that bullet. All right, let's talk about spongy bone's location. It's always located within the interior bones, protected by a covering of compact bone, makes up most of the interior of our short, flat, and irregularly shaped bones. And that's because, just like we saw in that slide a couple pages ago, the picture a couple pages ago, places like your shoulder blade and your scapula, or shoulder blade and your sternum, your skull, they're not supporting a lot of weight, so they don't have to be as strong as your long bones. So they can get away with having a lot more spongy bone. In our long bones, it does form the core of the epiphyses beneath the compact bone. We talked about that already. Down here at the bottom, we show the very proximal end of what we call our femur bone. Okay, your big thigh bone, the biggest, strongest bone. To show that, you can see there's a lot of spongy bone there. This would be right up there by the hip. Okay, over here on the right, we show that the trabeculae actually kind of align themselves, even though it kind of looks random. They do align themselves kind of in a specific manner to maximize the strength of the bone, which is very important, because that helps resist stress and transfer force without breaking. So it's kind of like how we talked about those dermal collagen fibers in our skin run in a specific manner. Same way with our spongy bone. And down here on the bottom left is an illustration, same bone, what can happen with osteoporosis. Okay, you hear a lot of times, grandma, grandpa fall and they break their hip. Okay, a broken hip a lot of times actually has nothing to do with the actual hip bone, but instead it's a lot of times a fracture of the femur right here, what's called the femoral neck. You can see how kind of skinny that is compared to the head and the rest. It's right in there where the head inserts into the hip. So it's at the hip joint, but it's actually a broken leg a lot of times. It's kind of misknown. Not worried about the images at the bottom, but I do want you to know figure B and C here in the middle of the page. As I mentioned earlier, our bones are living organs made up of living cells, and they need a blood supply. In fact, our bones are richly supplied with blood. We have blood vessels, especially abundant in portions of our bone containing red bone marrow that pass into bones from the periosteum. Literally, we have what are called periosteal arteries. Arteries are blood vessels that carry blood to the bone. We've also got periosteal veins, which are blood vessels that carry blood away from a bone. Okay, so they enter through the diaphysis and enter the diaphysis through the perforating canals to supply periosteum and outer parts of the compact bone. We provide the inner parts of the bone with blood vessels that pass actually through holes in our bones. And the word foramen refers to the fact that there's a hole through a bone. And at the center of our long bones, like our tibia that's shown here, is what's called a nutrient foramen. That allows a nutrient artery to come in. You can see it then forks to form a distal and a proximal branch. One travels to one side of the bone, one travels, in this case, towards the ankle to the distal end. Okay. We also have what are called metaphyseal arteries that travel in through metaphysis, and epiphyseal arteries that travel in through a hole in the epiphyses. Notice accompanying those red blood vessels, we always find a vein, which includes a nutrient vein, epiphyseal and metaphyseal veins, periosteal veins. What's not pictured here is the fact that we also typically have nerves that accompany those blood vessels supplying our bones. Nerves which are sensitive to different things, provide information, especially in our periosteum, to things like tearing or tension, which is going to protect our bones from being damaged. As far as the picture goes, I'm not really in love with it, so just worry about the information there at the top. All right, bone marrow, also known as myeloid tissue, located in the medullary cavity of our long bones and the spaces of our spongy bone. We've talked all about that today. And we've already mentioned that there's two types, red bone marrow and yellow bone marrow. Red bone marrow is hemo or hematopoietic tissue, which once again means it produces our blood cells. In children, virtually all bones contain red bone marrow. But as we get older, the number of bones that carry this red bone marrow starts to go down. Okay? So what we're left with as adults are bones, which include your ribs, the bodies of our vertebrae, the ends of the humerus, the sternum, pelvic bones, and the femur. Okay? That's because as we get older, we replace that red bone marrow with yellow bone marrow, okay, which is going to be just marrow cells filled with fat and have no role in blood cell production. Okay. Does that mean that we don't produce blood cells as we get older? Obviously, we still do. Okay, we just don't need as much red bone marrow to produce the amount that we need. Okay. But if we do have situations like anemia, radiation, or disease, we might not have enough blood cells, so we can actually revert the yellow bone marrow back to red bone marrow, which is very cool. Okay. In some drastic situations, a person may need a bone marrow transplant, And this is what it looks like for somebody that wants to donate bone marrow. The procedure involves a very heavy, thick needle that goes right into the interior of a hip bone. And so I would think that sounds pretty awful. And obviously, they're going to put some anesthesia in there, but as far as I'm aware, I don't think they put you out. They just deaden the area, shove the big needle in, has to break through the shell compact bone to get to that spongy bone to get that marrow out. Very common need for people that have like lymphoma and that kind of stuff, cancer can wipe out their immune system and they need bone marrow transplants. So I think anybody that donates bone marrow is like a superhero because it sounds pretty awful. All right, I'm actually going to skip to this very last slide because we're running out of time, and we'll talk about fractures on Monday. I want to talk about this last slide because this actually is information that relates to what we'll be getting into on Monday, where we're going through the different bones of the skeleton. Okay, there are going to be many, many bones that you're going to learn about, not only just the name of the bone, but you're also going to learn about these, what we call bone surface markings. Okay, so let's talk about what those are. Bones have characteristic surface markings, structural features adapted for specific functions. Most are not present at birth, but develop in response to certain forces and are most prominent in our adult skeleton. In response to tension on a bone surface from tendons, ligaments, aponeuroses, and fascia, new bone is deposited, resulting in a raised or roughened area. We also have what are called compressions that push inward on a bone surface, resulting in a depression. So there's depressions and openings, allowing for passages of small or soft tissues like blood vessels, nerves, ligaments, tendons, or to help form joints, whereas processes or projections or outgrowths that help form joints or serve as attachment points for connective tissues like our ligaments and tendons. This table is the table from the beginning of that chapter 7.2, so it's chapter 7 in your textbook, where we start getting into the axial skeleton, our next lecture. We're going to be talking about these things starting on Monday and through the next 2 lectures, where we talk about holes and processes and depressions. So take a look at this table. I think it will help you tremendously so that you're not completely confused when we talk about like the foramen magnum and the styloid process and stuff that we'll be getting into a lot next week. Okay, that's all I've got for you guys today. We'll finish this up on Monday and move on to the exoskeleton.